Welcome to this webinar on student health insurance for new students at the University of Chicago. This webinar is broken down into several parts. We encourage you to review all the chapters so that you're familiar with the content, which includes understanding U.S. health insurance, services you could receive directly through UChicago Student Wellness, the university's annual student insurance requirement, an overview of the university's student health insurance plan, also known as USHIP benefits and premiums, optional vision and dental insurance coverage, and a final summary of key points and contact info if you have more questions. In the United States, healthcare is very expensive and can especially be a financial burden for students with chronic conditions or who experience an accident or illness. Having health insurance is imperative so that you do not incur thousands of dollars in out-of-pocket expenses for medical or mental health services. In part 1 of this webinar, we will introduce health insurance terminology, as well as provide real-life examples of how health insurance coverage applies towards your healthcare expenses. First, an overview of terminology. Please note you can find an in-depth health insurance terminology glossary on the Student Health Insurance website. Premiums are the amount of money that you pay each year for the cost of your health insurance. The deductible is the amount that you need to pay each year before your health insurance plan starts to cover your medical costs. The annual out-of-pocket maximum is the amount of money you pay yearly for medical costs before your plan starts to cover all expenses at 100%. The deductible is included toward the annual out-of-pocket maximum. Coinsurance is a percentage of the cost of your treatment that you're required to pay after your plan's annual deductible has been fully paid. A copay is a fixed amount that you are required to pay upfront for certain services, and then the insurance will cover the remainder subject to the level of coinsurance. For example, a doctor's visit might have a $20 copay at the time of your appointment. In-network refers to the doctor's, hospital's, or other provider's relationship to your insurance company. If a provider is in-network, they have an existing agreement with your health insurance company, and you'll typically pay less in out-of-pocket costs. If a provider is out-of-network, you'll usually pay more. Finally, an explanation of benefits, commonly known as an EOB, is a statement you receive from your insurance company after you receive medical services. The statement is not a bill, but rather indicates what your insurance plan will cover and what will remain as your out-of-pocket expenses. Your final bill will come from your health care provider after the insurance company has sent its share of the payment. Here is a real-world example to help you better understand insurance terminology. Let's say that John has an injury requiring 2 doctor's visits. Under John's health insurance plan, he will have to pay a $20 copay at the time of his visit to an in-network provider. The provider will then bill his insurance the cost of the visit, in this case, $7,000 for the first visit and $4,000 for the second. John has an annual deductible of $400, and his plan has a 10% coinsurance. So for his first visit, he will pay $1,078, which equals the $20 copay, $400 towards the deductible, plus 10% of the remainder, or $658. For a second visit, he's already met his annual deductible, so he will only owe the copay of $20 and the coinsurance amount, which here is 10% of $4,000 less the $20 copay, or $418. Now, let's say that John is very, very unlucky and has another injury requiring 2 more doctor's visits that planned year. He already met his deductible with visit number 1, but he has not yet reached the annual out-of-pocket maximum. This means that for visit number 3, he still owes the 10% coinsurance, or $484, plus the $20 copay. However, for visit number 4, John has already incurred over $2,000 in out-of-pocket expenses for the plan year, so he no longer has to pay 10% of his cost because he now reached his annual out-of-pocket maximum. For visit number 4, he therefore has no out-of-pocket costs. As this example demonstrates, it is important to look at the amount of the annual deductible and out-of-pocket max on your insurance policy, as those factors will determine how much your insurance covers and how much you will have to pay out-of-pocket each year. To minimize your out-of-pocket costs further, we encourage you to utilize UChicago Student Wellness, located on the Hyde Park campus for your primary care. Both medical and mental health services are provided to eligible students at no cost, provided the services are received through UChicago Student Wellness. In Part 2 of this webinar, we provide an overview of the services you may receive directly at Student Wellness. Services that will be charged to your insurance are also reviewed. UChicago Student Wellness provides medical, mental health, and health promotion services. There is also a pharmacy in the DCAM building around the corner from the Student Wellness Center. Here are pictures of the entrance and one of the waiting areas of the Student Wellness Center. Please check the website for hours of operation and information on scheduling appointments. That address is wellness.uchicago.edu. Undergraduate students and most registered graduate students studying at the Hyde Park campus are eligible to receive services provided by UChicago Student Wellness. If you are unsure if your academic program is eligible to access UChicago Student Wellness, please check with your area dean of students. Eligible students can receive most types of routine health care, while other services will require your insurance to pay. As indicated on this slide, you can receive routine physicals, contraceptive consultations, and some basic labs and testing, such as screenings for sexually transmitted infections. These services are provided at no cost to eligible students. You will use your insurance to cover expenses such as prescription medications, x-rays, emergency room visits, hospitalizations, and consultations and treatment by specialists outside of UChicago Student Wellness. Eligible students can receive mental health services at Student Wellness such as individual and couples counseling, support groups, psychiatric treatment, and medication consultation and management. These services are provided at no cost to eligible students. For consultations or services received outside of Student Wellness, such as prescriptions and emergency room care, you will need to use your health insurance to help cover these costs. Regardless of your eligibility, all health promotion services, such as sexual health education, meditation, yoga, and stress relief workshops are available to any UChicago student. Now that we've covered what healthcare services are available to you as a University of Chicago student, let's talk about the university's health insurance requirement. In Part 3 of this webinar, we will review the student insurance requirement, including the requirements for acceptable waivers of the university-provided student health insurance plan, also known as UCHIP. For detailed information about the university's student health insurance requirement, benefits on UCHIP, as well as information about the optional dental and vision program, go to studentinsurance.uchicago.edu. Health insurance coverage is required for all registered full-time students studying at the Hyde Park campus. Students who are enrolled in part-time or evening/weekend programs may be exempt from the requirement. If you are enrolled in one of these programs and uncertain whether you fall under the health insurance requirement, you should contact your area dean of students. Students can fulfill the health insurance requirement in one of two ways. You can enroll in the University Student Health Insurance Plan, UCHIP, which is administered through United Healthcare Student Resources, or you could waive UCHIP by providing proof of comparable insurance coverage. Exception: PhD students are required to enroll in UCHIP. More information is on the next slide. Please note that UCHIP coverage is effective September 1st through August 31st of each academic year. If you will be arriving to campus before September 1st, you may be able to sign up for UCHIP early coverage for the month of August. Please contact your school or division's Dean of Students office to learn more about how to enroll in early arrival health insurance. All PhD degree-seeking students will receive their individual UCHIP premium coverage at no cost to the student. PhD students are required to enroll in UCHIP and will not be eligible to waive with alternative comparable insurance. Students who do not take action to enroll in UCHIP will be automatically enrolled for the year after the enrollment deadline. More information about the PhD UCHIP requirement can be found in the FAQ on the Student Insurance website. Please note, the UCHIP coverage is effective September 1st through August 31st each academic year, as long as the student remains registered at the university each quarter. The deadline to enroll in or waive UCHIP for the 2025-2026 policy year is Friday, October 17th at noon Central Standard Time. As mentioned on the last slide, PhD students are required to enroll in UCHIP. Non-PhD students can confirm or waive your enrollment in UShip beginning the first week of August at studentinsurance.uchicago.edu. If you have existing coverage that meets our comparable coverage requirement, you will need to waive coverage again every academic year by the deadline so that you are not responsible for the UShip premium. If you take no action to enroll in or waive UShip by the deadline, you will be automatically added to UShip coverage and the premiums will be reflected on your student account for the remainder of the academic year. Please pay attention to the email reminders we send regarding upcoming deadlines. Emails are sent to your @UChicago email address. If you plan to waive UShip coverage, you must provide proof that you have active comparable insurance that has coverage for the following. Your alternate plan must include essential health benefits as defined by the Affordable Care Act, a U.S. healthcare law. These essential benefits include things like outpatient medical care, hospitalizations, mental health services, and emergency room visits within the area in which you are residing. Your annual out-of-pocket maximums cannot exceed $9,200 for an individual and $18,400 for a family. The insurance policy must have been issued from within the U.S. F1 and J1 students, as well as students studying abroad, must have medical evacuation or repatriation coverage. The plan must provide immediate coverage for pre-existing conditions. And lastly, and most importantly, the plan must provide coverage for both emergency as well as routine non-emergency care like doctors and specialist visits in Chicago. If you plan on waiving UShip, please first review the comparable insurance coverage checklist available on studentinsurance.uchicago.edu before you apply for a waiver. You may need to call your insurance company to confirm whether your coverage meets the requirements, so be sure to leave adequate time before the final deadline to do so. If your coverage meets the requirements, you could waive UShip and use your alternate insurance plan. Remember, each year that you're registered at the university, you will need to take action to enroll in or waive UShip with proof of comparable coverage. If you will be enrolling in UShip, you may choose to enroll your dependents on UShip along with yourself. In order to enroll dependents, you'll need to request that they be added to your coverage each year during the open enrollment period, which typically starts in early August. Proof of dependent status, such as a marriage or birth certificate, is required for the first time you enroll your dependents on UShip. You can find a full list of acceptable documents, as well as detailed information on dependent enrollment on studentinsurance.uchicago.edu. As previously mentioned, the final deadline to enroll or waive UShip is October 17th. However, you may be eligible to enroll or waive coverage at a later date if you have what is called a qualifying life event, such as aging off of a parent's insurance, getting married or divorced, a change in employer-sponsored insurance, and the birth or adoption of a child. If you experience a qualifying life event and need to enroll in or waive UShip outside of the open enrollment period, you must contact the on-campus insurance office no later than 31 days from the date of the qualifying life event. As a reminder, PhD students are not permitted to waive UShip. For example, let's say that you are currently on your parents' insurance but will no longer be eligible after March 1st because you are turning 26 years of age. At that time, you'll need to enroll in UShip, and you would have until March 31st to contact the on-campus insurance office to begin the process of enrollment. However, if you have a qualifying life event and will need to enroll mid-year, we recommend you contact the insurance office as soon as possible to ensure a smooth transition. Now that we've discussed the university's student insurance requirement, as well as the requirements for enrolling in or waiving UShip with comparable coverage, let's talk about UShip. In Part 4 of this webinar, we will review your benefits under UShip and discuss how you will pay your premiums. Remember, premiums are what you pay upfront in order to be enrolled in UShip. Before we start talking about your UShip coverage, it is important for you to know that there are people on campus dedicated to helping answer your questions about UShip. Mia works for United Healthcare Student Resources, our student insurance carrier, and is located on campus in the Student Wellness Center. Any questions about your UShip policy benefits, claims, or enrollment questions should be directed to Mia. Celia works for the university and can answer your questions about the university's policies regarding student insurance. Now, let's take a look at how UShip coverage is structured. Your annual deductible for in-network providers is $400 or $800 for out-of-network providers. Annual out-of-pocket maximums if you seek in-network care is $2,000 versus $3,000 for out-of-network. The coinsurance under the USHIP plan is 10%, which means that the plan pays 90% after your annual deductible has been met, and you will pay the remaining 10% until you reach your annual out-of-pocket max. Prescriptions are paid on a tiered copay basis at in-network pharmacies. Typically, generic brand drugs will fall under Tier 1 and have a $10 copay. Name brand drugs will fall under Tiers 2 and 3 and have copays of $25 and $40 respectively. There's a $20 copay for in-network doctor, specialist, and mental health visits outside UChicago Student Wellness, and a $10 copay for psychotherapy visits with specific community providers on a list available through UChicago Student Wellness. USHIP is part of a national network, United Healthcare Student Resources, and you will have insurance coverage whether you're at school, home, or anywhere away from campus. If you live or travel abroad during the plan year, international coverage is included and reimbursed at an in-network rate. Additional benefits include global emergency services when you are traveling abroad, on-campus insurance support, a nurse advice line, and telehealth for 24/7 access to a physician or mental health provider. There are many ways you could get the most out of your USHIP benefits. As previously discussed, if you are living on or near campus, UChicago Student Wellness is able to provide your primary care at no cost. If you choose to see a provider outside of UChicago Student Wellness, we recommend you choose an in-network provider, as your out-of-pocket costs will be much lower. Also, the DCAM pharmacy has a special arrangement with USHIP. You could receive 90 days of prescription for the price of only 2 months copay for most medicines that address chronic conditions. The DCAM is located on the first floor of the Duchossois Center for Advanced Medicine building, around the corner from Student Wellness at 58th in Maryland. Lastly, you should review the list of exclusions and limitations on USHIP before obtaining services outside UChicago Student Wellness. Not all procedures are considered eligible expenses. For example, elective surgeries are generally not covered by USHIP. If you have questions about coverage, you should contact the on-campus student health insurance representatives at UChicago Advocates at uhcsr.com. Now that we've talked about the benefits available on USHIP, let's discuss the cost. This slide shows the USHIP premiums for the 2025-2026 academic year. Remember, the premium is the cost you pay per year to be enrolled in USHIP. For a student, the annual premium is $5,145, which is broken out into 3 quarterly installments of $1,715. If you need to add a spouse or a partner or a child, that would be an additional $5,145 per year. For a spouse or a partner plus one child, your total cost would be $15,435, and if you have a spouse or a partner plus 2 more children, the annual family rate would be $20,466. If you were admitted with a funding package that includes health insurance, you will not be charged the annual premium for health insurance if you enroll yourself in USHIP. This includes PhD students who are required to enroll in USHIP. However, if you have dependents and enroll them, you will be charged for their premiums, and if you choose a health insurance plan other than USHIP, it will not be paid for as part of your funding package. USHIP premiums are billed in 3 installments on your bill from the university's bursar's office in autumn, winter, and spring quarters. USHIP coverage continues through August 31st, though you will not pay a summer premium. If you will be starting school any quarter other than autumn, you could view your billing cycle at studentinsurance.uchicago.edu. Please note that you are automatically assessed an insurance fee on your student account. However, you must enroll in USHIP to confirm your coverage or waive coverage with alternate comparable insurance to have the charge removed. We know that premium costs may seem high, especially for those of you not familiar with the U.S. healthcare system. So we want to include a comparison of the USHIP plan and 2 other plans that we know meet the comparable coverage requirements for the university. USHIP is a platinum-rated plan under the Affordable Care Act, meaning it is in the category of plans that pay the most to cover your healthcare costs. As you can see, the premium for USHIP is lower than the Blue Cross Blue Shield of Illinois PPO Gold option and the Cigna HMO Gold plan. USHIP's deductible of $400 is lower than that of Blue Cross Blue Shield or BCBS and Cigna, as in the annual out-of-pocket maximum. USHIP also provides a higher coinsurance rate of 90% compared to 80% and 75% for the other plans, meaning USHIP would cover a higher percentage of your healthcare costs. To consider how these factors will impact your healthcare costs, let's look at a real-world example. If you were faced with a $5,000 medical bill on each of these three plans, you could see that you would end up paying significantly less out of pocket on UShip. On UShip, you would pay $860 out of pocket for that $5,000 medical bill, while if you had the Cigna plan, you would pay $2,375 or $1,600 on the BCBS plan. This example demonstrates why it is important to consider the deductible, coinsurance, and out-of-pocket maximum when looking at alternative health insurance plans, not just the cost of the premium. In this section, we will briefly discuss optional dental and vision coverage. Dental and vision services are not covered by UShip insurance, or generally by any medical insurance plan in the U.S. The university offers both vision and dental insurance as optional coverage for our students. You can enroll in the dental or vision plans regardless of whether you enroll in UShip. You will pay annual premiums directly to the insurance carrier. There are three plans available for dental care, and you can see the basic benefits here. Information on costs and complete benefits can be found at studentinsurance.uchicago.edu. We also have a vision plan available to students, and you can see the basic benefits here. Information on costs and complete benefits can be found at studentinsurance.uchicago.edu. Like UShip, the deadline to enroll in the optional dental and vision plans is Friday, October 17th. Finally, let's take a moment to summarize what we covered in this webinar. U.S. healthcare and health insurance is very complicated and expensive. It is important to have health insurance to minimize your potential out-of-pocket costs for receiving care. A glossary of health insurance terminology is available in this webinar and also through studentinsurance.uchicago.edu. College students and most graduate students are eligible to receive healthcare services directly at UChicago Student Wellness. Most services are available at no cost to eligible students. Some services will be billed to your insurance. The university requires all students to either enroll in UShip or waive UShip with alternate comparable coverage. This is an annual requirement. If you would like to review alternate insurance plans, make sure you consider the impact of all your potential costs, the premiums, the deductibles, the out-of-pocket maximums, coinsurance, and copays. You must also ensure your alternate insurance plan meets the university's comparable coverage requirements and review exclusions and limitations very carefully. Remember, the autumn quarter deadline to either enroll in UShip or waive UShip with comparable coverage is Friday, October 17th at noon. If you do not take any action, you will be enrolled in UShip and charged the $5,145 premium in 3 equal installments on your university bursar bill. Finally, if you have questions regarding your insurance, enrollment/waiver procedures, or the UShip plan in general, you would contact the on-campus insurance advocates available Monday through Friday from 8 a.m. to 4:30 p.m. in the Student Wellness Center. You could also email them at uchicagoadvocates@uhcsr.com. If you have questions about the university's health insurance requirement, you could contact Celia Bergman, Program Manager at Student Wellness, at cbergman@uchicago.edu. Thank you for joining this webinar. We hope you have a wonderful year ahead.